Hi, I'm Kieren.
And I'm Riku.
Welcome to Artificially Ever After. For today's episode,
can AI help fix the NHS? Welcome back. Thanks for tuning in.
Hi, everyone.
So we're going to talk about AI in the NHS, but before we get into it, we're just going to mention that we have got an episode on An AI Day Keeps the Doctor Away.
Yeah.
So we encourage you to listen to that.
Yeah, it just gives like a general overview of AI in healthcare, which I think there's so much to talk about on this topic. So it does kind of set the general scene. And then today we talk about things a bit more specifically within the UK's National Health Service, where, obviously each health service is going to be different in different countries. So yeah, definitely go and listen to that firstly if you haven't already.
But as we'll find out, the NHS is adopting AI, and maybe it can be a case study for other countries.
Yeah, I mean, NHS is suffering as a free healthcare service, and there are some kind of shocking figures that there are more than 7 million patients on the NHS waiting list in England currently, and around 100,000 staff vacancies. So, I think it's quite commonly felt in the UK that the NHS is suffering. We're going to talk today about how things might hopefully change in the coming years.
Yeah, and we've recently got Labour voted into Parliament, and they promised to build an NHS fit for the future. And in this episode, we're going to talk about how AI can help with Labour's goal. And to help us with that, we have a very exciting guest who has the perfect background for that.
Yeah, so this is our first guest episode, so we're super excited to have someone on the podcast with us. And we've set the bar extremely high for our first guest. So today we're going to be talking with Dr Hatim Abdulhussein, who's the former National Clinical Lead on AI within the NHS England, and now on the board of the NHS AI Lab. And he's the CEO of Health Innovation Kent, Surrey, Sussex. So he is working to transform lives through innovation and technology, and he's at the forefront of integrating AI within the NHS. So we've got loads of very exciting questions for him. And alongside all of his work, he's a practising GP as well. So somehow he's managed to squeeze in the time to chat with us. So without further ado, let's get into it.
Yeah, first question, just hear a bit more about you and your journey. So what drew you to medicine, and especially what drew you to such an early interest in AI medicine, kind of before it was cool?
Yeah, so medicine, look, I think for me, there aren't many other jobs in the world where you can make a massive impact on people's lives. So, even as a 14, 15-year-old snotty teenager who had no idea what he wanted to do with his life, there was a draw to doing something like that. And my brother had some issues when he was a child with his kind of from a musculoskeletal perspective. So he spent some time in hospital when he was young as well. So that was a factor also. And I just liked science and found the body interesting and various things. And then when I went through medical school, I don't think I ever really knew what I was planning to do. I don't think I ever had a set, this is going to be my specialty or career pathway. Until about kind of third or fourth year, when I got really interested in sports and exercise medicine, which is a field of medicine where actually cuts across dealing with musculoskeletal issues without people having to have surgery, but also exercise and getting people to be more physically active. So an element of public health there to try and prevent disease in the first place, and to use exercise as a treatment to make people healthier. And whilst doing that and kind of going down that pathway, I happened to then find myself kind of moving into the more technology innovation space and AI. And to be honest, a lot of it happened by chance. So one of the things I did do was I took a year out when I was a doctor to do something different. And the NHS has a management scheme called the National Medical Directors Fellowship if you're a doctor, and if you're a dentist or a pharmacist, there are equivalent schemes. And it takes you out of your day job as a doctor for a year and moves you more into a managerial role, but working with a healthcare executive that's usually a doctor or other healthcare professional. So I was working with the medical director at Health Education England, which was the national body for workforce, for training, for education for the whole of England, and spent a year with that individual and their team and other executives and other healthcare leaders. And it just gave me a completely different perspective of where you can make change and where you can make things happen. It gave me a different perspective of the jobs that we don't see. So as a doctor, when I go in, I see my patients, I see my staff in my surgery, or if I'm in a hospital, I see other members of staff in the hospital. But actually, there are people that are in the background doing some really important roles, making some really important change, or measuring and making sure the NHS is safe and effective, and they're making sure that financially it works, given the massive beast that it is.
Yeah.
So ultimately it's an 18 billion pound industry, right? So people kind of in these jobs, and it gave me a whole perspective on that kind of the wider part of healthcare and what drives it. And I kind of got the bug for it, really. And during that year, there was a lot of work that was happening around technology. We were looking kind of 20 to 25 years into the future with a guy called Dr. Eric Topol, who's a physician scientist from the Scripps Translational Research Institute in California. And he had been asked by the Secretary of State at the time for Health and Social Care in the UK to look at technology and how it's going to impact the NHS in the future, and particularly how we're going to get a workforce that's ready for it. And lots of recommendations came out of that. And I got involved with taking on some of those recommendations. So it was kind of, right person in the right place at the time. And it's kind of led to, particularly when you said about AI, it just led to us really being able to take some time to think about it and do some things around it before, it really became the thing that it is now, which pretty much everyone talks about.
Yeah, I imagine you've got a lot busier recently with all the stuff going on. But it's interesting because I feel like you sense, or sometimes as a patient, you kind of sense a general negative sentiment from doctors, at least, or GPs towards computers and like digital technologies, whereas you've obviously gone completely the other way. So on that then, to look at how they could kind of transform things. Obviously, Labour now coming into government have said that they want to build an NHS that is fit for the future. And just to kind of list off some of the kind of key things, at least in their manifesto, that they're wanting to achieve with that. So they obviously wanted to cut wait times, making 40,000 more appointments every week, double the number of cancer scanners, recruit additional mental health staff, and bring back the family doctor as well. So just from someone in your position who is at the heart of that innovation, what are some of the ways that AI can help specifically achieve those goals, and what are the biggest barriers? Because they do mention AI and automation in the manifesto. So is AI going to help with these goals?
Yeah, they do. And Keir Starmer has also just recently done his speech around, what Labour will be prioritising kind of it coming into the next spending review and the budget. And again, it's talked about AI for public good.
Yeah.
And that's a good thing, because what it means is we recognise this is a very powerful technology, and we recognise there's lots of investment that's going to go into it. Why shouldn't some of that investment go into challenging some of the challenges that we have in our public sector? Because everyone wants better health care, everyone wants better social care, and the reality is that as time goes on, people are getting older, people are getting more complex. 1 in 5 people are likely to have some sort of long-term health condition by 2040, and we will have an imbalance in our population, not completely, but we will have some level of imbalance between people that are older than 65 and people that are under 65. Means that we won't necessarily have the same balance that we've had up till now, which means that we might not have enough people caring for that population that gets older and sicker and has multiple diseases and needs more help and care. And so to deal with all of that, you need to utilize technology. I think for that is a no-brainer. And some people might say it's hype. For me, there's no, there's people describe it as the kind of fourth industrial revolution. There's not a more exciting and transformative technology than artificial intelligence if we move away from the hype, we bring it down to reality, and we really think about what can we utilize the technology for right now. And so all of the things that you described are problems, and there have been problems for many, many years, right? Waiting lists, they're probably enhanced by the pandemic and various other things. But people have for a long time struggled to access their GP or sat on waiting lists, and therefore these, or sometimes, and actually our cancer outcomes have unfortunately not been where they used to be in the past, and we haven't always hit targets in these areas. So that's really about them bringing back to, what does this technology actually do, and what can it do right now, and how can we use it to solve some of those problems. So when it comes to accessing your GP, we know this technology can be used in triage. We are seeing it. We're seeing it piloted, and we're seeing surgeries where have been able to use artificial intelligence to triage patients, so to manage demand and flow, and make sure people see the right person at the right time, has led to GPs being able to have longer appointments, has led to general kind of freeing up of staff across the board, including administrative staff, has led to quicker responses for patients in terms of getting an appointment when they need to. So we're seeing some of these changes through the use of AI, and therefore we should be capitalizing on those opportunities. Similarly with cancer, a number of technologies that I've seen that even the administrative side are showing how we can speed up processes between, all of the things that happen if someone has cancer or is being referred for a diagnosis of cancer, in terms of how quickly they get their imaging, in terms of how quickly they then get a treatment plan, how do you quickly bring people together, how do you communicate with them effectively, because it's such a difficult time for anyone in their lives if they go through a cancer diagnosis and treatment. And so making that easier for the patient using technology, again, it's a no-brainer, and the technology is ready. The challenge with all of this is spread, doing it across the NHS. And it's also recognizing that technology might work, but it requires much more than the technology for it to be effective, and recognizing that people and process are really the critical parts of this. If we can align people and process to the technology and kind of do the right amount of transformation and change management, then you're much more likely to be successful in its application, and therefore see the bigger scale effects and efficiency savings and kind of freeing up of time that we all hope for.
Yeah, super interesting.
Yeah, we're really interested in that, especially that kind of side point that often gets missed about the importance of people in the pipeline, not just technology. But just before we move on to that, as you've said, that these problems, all 4 of these problems have been a problem for a long time, especially with cancer scans and things. But what do you think about the short-term kind of additions to the pipeline? Like, I think a lot of people are wondering, is an AI going to be the thing that decides my cancer diagnosis, or who's going to be making that decision, because it's such a big one? Do you have any kind of predictions or anything to say about the near term on that?
Yeah, the near term, we will not see artificial intelligence making any diagnoses or anything like that on its own autonomously. Absolutely, it's just nowhere near a reality. There's lots of regulation. The technology actually isn't there yet, if I'm honest, to do it autonomously, and yes, it's far more complex than that. And actually, I'm a firm believer that that's not where we should be heading anyway. Research is showing that artificial intelligence is there to augment human capability and capacity, and actually, if you join up the human with the AI, you get to a much better, much more balanced effect or area, because we know these technologies are biased, right, or can have levels of bias within them. We know when it comes to generative AI about hallucinations, about data drifts, about all sorts of things that make this technology potentially very unsafe if not used properly. So let's not pretend like it's perfect, but let's recognize that actually there are some strengths there. And if you join it up with a human being, then actually augmenting that activity, the two coming together, could really get us to an amazing space. So for example, when I'm sitting in my clinic room with a patient in front of me, making that potential diagnosis, how helpful would it be to me if there was a tool in my clinic room that was helping me to make that decision more quickly, that was providing the information that I really needed in a more effective way, and giving me some sort of suggestions? There's nothing wrong with that. Then I would then make a decision with the patient in front of me about what we do next. That would augment my activity. And we've done some research to show, very early stage, but we've done some research with the MHRA, which is the regulatory body for medicines and kind of healthcare and software devices, around the human AI interaction piece. And we found that actually humans and the AI look at different things, different parameters. The AI can actually be much more broader in its outlook and much more confident in its decision making, whereas humans can be much more balanced and much more narrow in the factors that they're looking at. So if you bring those things together, I do believe you get to a more effective model of decision making.
So one of our questions we did have perfectly on that is, we're fascinated to know what happens when you then run into a scenario when you have differing kind of diagnoses or predictions. So, I think I've read a really interesting study, which was that some of these AI prediction tools, I think it was for some form of scan data, the overall kind of performance metrics were worsened when you actually include humans in the loop. Obviously, that's probably a very rare case, but who is making the decisions on who has the final say?
Yeah, that's really interesting. So in our research, we also found that when the AI was wrong, and we purposely put in cases where the AI was wrong, the humans were more likely to agree with it and go the other way, and vice versa. If the AI was right, then kind of positively reinforced. And that's a key challenge we're going to have to work out. And that kind of that comes down to that kind of human AI interaction piece, where how do we nail that and get it right? Because actually, the reality is you're not taking the human out, right? At least in healthcare. In highly regulated industries like healthcare, like the financial industry, the human is not going anywhere, right? These are very personalized environments, right? You go to a doctor. When you're in hospital, you have staff in the hospital that are providing your care. Like yes, there might be some that say let's reimagine that, but that's a long way away. So actually, we have to find ways for the AI to work to support human activity, and for where the AI, like you say, sometimes when it works with humans, you sometimes end up with poorer decision making. Well, why is that happening, and what do we need to address for that to improve that? Because otherwise we're just not going to get that facilitation and integration of this technology in healthcare, because as I said, no one is at the moment, there isn't an appetite, and I see this with the kind of the engagement with people as well on the ground and citizens. There isn't an appetite of not having a doctor, of not having someone that you want to go and see. In fact, people want more access to healthcare professionals. That from what we're seeing is increased demand, not decreased demand on healthcare services. And so we have to find ways to integrate it in an effective way that enables people to make better decisions and quicker decisions.
Definitely. I think one concerning thing on that, I guess, though, is that the Health Foundation, I think they recently released their latest survey on public sentiment towards AI. And there definitely did seem to come up these concerns that doctors using AI, it could actually then, or interacting with AI, because it can't show kind of real or genuine empathy or kindness, would then actually make them feel more distant with the healthcare professionals. So I think we definitely need to make sure that it's kind of working in assistance rather than kind of being in between the two, don't we, I think?
And it's interesting because actually the Topple review talked about how AI and other technologies would give time to people providing healthcare. And actually that was, Eric Topol, if you read his book, talks about how artificial intelligence will actually improve compassion and empathy in healthcare. And there are some that have shown that actually AI in itself can be more empathetic than human beings. So there is the relational aspect of healthcare is tremendously important. I think it's the most important part of healthcare. When I went through medical school, we spent a lot of time on communication skills, and being healthcare professionals to support people, because people come to healthcare when they're in vulnerable points in their lives. And so, thinking about how we can use AI to make those situations better, i.e., when I'm sitting in my clinic room, I really don't want to be sitting in front of my computer, typing away or looking for guidance. I'd rather be looking at the patient in front of me. So how much better would it be if, one, it was doing my notes for me, two, it was doing any onward referral or administration for me? That'd be amazing. And three, as I'm actively speaking to the patient and I'm thinking about my diagnosis, I can say to the computer, well, actually, I think that this patient has asthma. They're at this point of their treatment. What is the next point based on the British Thoracic guidelines or the NICE guidelines? And being able to interact in that way would create a much more personalized consultation with the person. I frequently hear that when you go into the doctors and they're sitting there on the computer or they're Googling away. The reality is general practice is an extremely complex environment to work in, as are other healthcare environments. And you can't stay on top of everything. And sometimes I'm actually just looking up what the referral guidelines are. Or I'm looking up what the next antibiotic is for this patient based on what they've got. And that stuff takes time. I need to go off and look for the right document, etc., etc. There's ways to kind of use technology to augment that part of the job, so I can really concentrate on the individual in front of me and that relationship and making them feel comfortable and helping them navigate their healthcare problem. That will be a win-win for all.
I think Riku, you'd said recently you'd been in for your shoulder surgery, hadn't you? And the doctor was kind of typing away, which, obviously they have to. And I think you often experience that, don't you?
Yeah, I was thinking, I wonder if you see this kind of coming in soon. It's like like an automatic transcription as you're having a consultation kind of thing. That seems like, especially with chatbots and things. Do you think that kind of thing is around the corner, or?
Yeah, it's not far away. So there are a number of what we describe as ambient voice technologies, using a mix of AI, multimodal AI, to most of the time multimodal AI now, particularly with LLMs, to be able to help with that transcription, help document alongside that transcription, and actually in some cases now starting to generate, well, actually here's some ideas or here's some next steps. I think that's very exciting. There are challenges in terms of regulation, governance, how they fit into our healthcare records and systems that already exist, training, and kind of, as I said, all the people and process stuff. You know, there's lots to work through, but there are a number of technologies in that space now. We're seeing some surgeries use them, and I had a GP the other day say to me, in a workshop that we held, I've been using it, and actually for the first day in my career as a GP, I managed to finish early. Like,
wow.
because it's just saved me that much time.
Yeah,
And
that's
so
the potential, isn't it? Yeah.
that's the potential. That really is. You know, you have a happier, less stressed out workforce, less burnt out workforce. You know, that is a real big area of success with these technologies, and they do exist. And like I said, there's things to work through, but you know, those things can be worked through. I don't believe they can't.
I think so. I mean, we're obviously fully on board with the potential of AI, given we're doing research in it. But I think just to kind of play devil's advocate and hone in on, we're not going to cover all of those hurdles, but I think one big one, which I think the general public grasp quite intuitively, is bias. And I know you obviously mentioned that, and it's part of that trust element. So how do we make sure that these new kind of deep learning models don't exacerbate existing inequalities? Because, I think we strongly believe that they have the potential to mitigate them and make them better, but it's definitely not going to happen automatically. We need to make sure that they're not heavily biased, don't we? So,
and that's probably the one that worries me the most, actually. Of all the risks around artificial intelligence, bias is the one that bothers me, because if you have bias in your healthcare, you just get more inequality, and more disparities. Particularly, we have a beautiful thing in this country of a kind of a public universal healthcare system, which I'm very, very proud of. And if you get variation, if you don't get the right decisions being made based on the populations that you're looking after, you can unfortunately make things worse, and that is a concern. I think there's a lot of work that's already been done in this space, particularly around research, and NHS England and other kind of bodies have done a lot of work in that. And we also have to remember that inherently healthcare is kind of biased historically. So we know that a lot of decisions that have been made based on medications, based on drugs, were made on trials that were not diverse in populations. So actually we have an opportunity through the use of this technology to address these problems, because we suddenly can start working and building things on diverse data sets that are more accurate and representational of the population. We're part of my job is we're working on a secure data environment in Kent and Medway and Sussex, which is per population about 3 million people. And having that data in an anonymized way allows us to test innovation in a safe way, and build innovation for the right population. And so if you put in the right things, then you can address it personally. And we're doing some research also to look at this. So we're doing some work with the Centre for Population Health and Absolute Diversity to look at particularly gender bias in AI, and kind of come up with some recommendations about how to kind of look out for it, solve it, think about it when you're buying technology, because I think that's the key as well. Is the reality is the NHS doesn't produce a lot of these things itself; it buys these technologies, and therefore when people are procuring them, are they thinking about bias? Are they, and also when people are using it, are they thinking about bias? And so I think one way you address it is by making sure that along each kind of part of that AI life cycle, in terms of adoption, you've got ways to check and challenge, you've got ways to escalate, and you've got ways to change if things aren't quite right.
Yeah, because we often say, don't we, that at least the data-driven AIs and deep learning models are inherently biased just from how they're built and trained. So, don't talk about it like it's taboo. Just kind of be aware and accept it, and then act accordingly, I guess.
Yeah, really curious just to kind of bring back a previous point about the adoption and so I guess part of this, the bias and just people's AI can be quite a complicated thing to grasp. So do you have any kind of advice for the general public to educate themselves to feel more trusting in AI in healthcare? Because it's obviously such a sensitive field. Is there any sort of advice you can give on how they can learn more and feel more confident in, the knowledge that's going to start getting used?
So I think the first thing to say is involve yourself in the right groups that are making some of these decisions so that you kind of have sight of what's happening if it's an area you're really interested in, because that's a good place to start, is to know what's going on and be able to co-design and kind of come in with the right attitude to say, we're not sure about this, we're going to learn about it. And I say that because one of our patient representatives is, when I first met him, was quite against AI and was a bit worried about this technology. And since then, I've involved him in some workshops. I've shown it how could potentially be used to train doctors and other healthcare professionals for the future to be better at picking up colorectal cancer, for example. And that was like, wow, this is great, right? So I'm always taught actually some of it is kind of just making it a reality to someone and making them see how it can be used in a way that they can understand, and that is one way to understand what it is. And then there are resources that are out there. I know Imperial had put, I was part of a working group that used to produce these resources for cancer patients to make them understand what these technologies were, particularly AI in the future, and kind of some of the basic principles around it. So there is it's important to try, and you don't need to be an expert, but understanding at kind of a basic level how this technology works, what it does, kind of some of the basic definitions and maybe some applications is a good place to start.
Super interesting. So doctors themselves, I guess, as well, is their kind of curriculum, will they be changing, and other skill sets that are required? Are they going to be varying now for the next generation of doctors also?
Yeah, absolutely. So two things I'm very proud of in that space is when I was at NHS England, we published the AI and Digital Healthcare Capability Framework, which was a framework that actually looked at all members of staff in the NHS and what do they need to know about AI, data science, and other digital healthcare technologies, particularly in their application for the future. And no doubt that will need to be refreshed at some stage, but it's a great starting point and a real kind of world leader in that space. And the second area is at Brunel University London. I helped them build their Technologies for Health module, which was a longitudinal module covering aspects of technology in healthcare for the next generation of doctors. And the more and more we see that enter medical school curricula, the better, because it's important that, as I said, we don't need to be experts, right? Even I don't feel like I'm an expert in, I know quite a bit about AI because I've been in this space for a long time. But when it comes to the technical aspects of AI, I'm not a computer scientist. I'm not a data scientist. I'm not a data engineer. I'm not an AI engineer. Not a prompt engineer. None of these things, right? I'm not someone that has those set of skills. But what I am is someone that's able to understand the principles of the technology and apply it to my field of practice. And so, if we can have more and more doctors understand those principles in the same way that I understand the principles of an MRI, X-ray machine, various things that I use day in, day out as part of my job and my decision making. AI needs to be a part of that because it will be so incorporated into our practice for the future.
So on that topic of the future, just conscious of time, just wondering if we could end on as a key figure. I know you're saying not an expert, but you are a very key figure in integrating AI into the NHS. So, can you give us a vision of your utopia of future healthcare? What is if let's say AI kind of did pretty much everything we want it to do currently, how do you see the balance between what's going to be left to the machines and what's going to be left to the humans? Can you just give us this kind of vision?
So Eric Topol described the vision in that letter to the Secretary of State when he wrote the Topol Review, and he talked about a fair, this is kind of paraphrasing, a fair, rational, tailored to the individual healthcare service that uses the convergence of AI, genomics, telemedicine, biosensors, Internet of Things more widely, crypto, kind of blockchain, for example. We utilize all these technologies to create a much more personalized health experience for people. We're able to predict disease earlier. We're able to understand what the factors are that are going to be able to lead disease. We're able to tackle some of the social determinants of health that actually healthcare can only solve about 20% of this, and the rest needs to kind of sit within society more widely. If we can take that kind of broader approach, more holistic approach to healthcare, that would be the utopia for me. And therefore, it would be keeping people in the community as well as possible, and only really using hospital as a factory environment to do the kind of core things that need to happen in a hospital. Allowing a mixture of people that work in that community setting, general practice, public health, dentistry, optometry, pharmacy, to be able to truly keep people well in their communities, for me, is that utopia, and I think technology can help us achieve that.
Very cool. I mean, we're definitely rooting for the AI, being AI researchers, but we hope that utopia comes true. I mean, it's so fascinating, and I think there's so much changing. Obviously, even just AI development more broadly is so rapid. So it'd be fascinating to see what happens. And yeah, we might have to get you back on to give us an update on things in a few months' time, because no doubt things are changing very quickly in healthcare as well. But
the reality is, this technology moves so fast, right? And I mean, it's really, the biggest analogy for me is when we produced that AI and digital healthcare capability framework, we didn't mention generative AI specifically. And look at kind of where things are now with kind of frontier AI models and kind of where they're heading. So it is going to move incredibly fast, and that's okay. Being able to take that step back and again bring it back to kind of what can you do right now, what's real, and also just recognizing that we have regulation, and that regulation exists to keep us safe. And so things will have to go through regulation, and they may take time, and that's fine, because we need to make sure this is going to be safe. Is an important kind of attitude to have towards this.
Awesome.
Wow, there's just so many really interesting conversations. It's just like half an hour, it can't do it justice.
But we're super conscious of your time. The last thing is just the kind of fun fact segment. You had a really interesting one, didn't you, that I actually didn't know myself, but...
So there's a study that shows that AI can actually look at a chest x-ray, or an x-ray more generally, and be able to tell the ethnicity of someone, which is fascinating, right? So if I look at a chest x-ray, I can generally tell gender, I can't tell ethnicity, without obviously having the name and the patient's details, etc. So the fact that artificial intelligence has been shown that it can do that is mind-blowing. And again, just shows the potential of this technology.
It's crazy, isn't it? And just showing that it's, the patterns it can pick up are just, I guess, far beyond what we could. So that's super interesting. I had one, again, healthcare specific. We normally try and just be super general, don't limit ourselves to staying on the topic of the episode, because it's quite hard to find these facts sometimes. But I found this really amazing story, and there are probably lots of ones like this, and there are obviously caveats and things. But in 2018, there were a team of neurologists in China. They compared their assessments of coma patients to this AI model. And they had this ranking system for their likelihood of kind of coming out of the coma and recovering. And these neurologists, for 7 patients, actually ranked them with very, very low scores for recovery. The AI gave complete other end of the spectrum and actually ranked them close to full scores, which means that they were likely to recover within 12 months. And all 7 patients actually woke up from their comas, which I just found amazing. But obviously there are probably a ton of caveats within that, but it's still fascinating to kind of see that potential, isn't it?
Yeah, it's crazy. I mean, all of this shows that, again, it's just the potential is there if we harness it.
Yeah.
My fun fact's not very cool, but I mean, but I didn't know that this was possible. So in 2022, a research team in Loughborough got some AI to work where it just takes in your breath, so it kind of smells your disease, and it can apparently diagnose like cancer, Parkinson's, and other things. I think it was particularly motivated by COVID, because it's such a fast scan. You just breathe into this thing and it'll tell you your diagnosis within a day. So
there we go. I think we'll be revolutionising diagnostics, and actually that would be amazing as well. And that kind of is a really cool part of that vision, because if you can do that, you don't need everyone doesn't need to go to the hospital. They go down to their high street and do a quick test and understand their health better, or maybe even in their own homes.
Amazing. Well, thank you so much. It's been super cool to chat with you, and I know we were conscious of time, but we would love to have you back on if that's something in the future we could do. But yeah, that was very interesting, and we're excited to see where things are going with AI in healthcare. And yeah, like we say, we're rooting for it for sure.
No problem. Lovely to join you, and thank you for your time.
So, hope you enjoyed our first interview episode.
As much as we did.
Yeah, it was a lot of fun. I think half an hour just to talk about this stuff is just not enough. There's so many interesting conversations there.
Yeah, we're super lucky to speak with Hatim for even a brief period of time. But yeah, if you have any guests that you might think we should get on in the future, or any topics you'd like us to cover, please reach out. We'd love to hear your feedback and episode suggestions. So you can reach us on Twitter, Instagram, contact@artificiallyeverafter.com is our email. So yeah, please get in touch.
Yeah, and our next episode is going to be on creative AI.
Yeah.
So talk about diffusion models, if you heard about that. So famously, some AI models won like art competitions and things. And we can talk about how do those things actually work.
Yeah, using AI to generate new art, images, music as well, some video stuff. So yeah, all these different areas when it's doing these creative tasks that for a very long time people thought would be untouched by AI. So yeah, stay tuned for that. And thank you for listening today, and we'll catch you next time.